Good evening, everyone. Thank you for joining the LGBTQS plus family planning webinar. So we're recording this video, as I said, to be able to share it with those who weren't able to make it tonight. So I'm Dr. Dixon, and I am the CEO and Medical Director here at Inova Fertility and Reproductive Health. And we have really loved celebrating Pride Month with everyone this year. And as we wrap up this month of inclusivity, I wanted to join you live on Zoom to answer some questions we've received throughout the month. So we believe we've received top 10 questions, I would say. So we're going to go through those and I'll answer those to give a little bit more information about family building for the LGBTQ2S plus families. And I have to say that we know at Inova that Pride isn't only for the month of June, that Pride is throughout the year, and our LGBTQ2S plus community is precious to us. And we love to help those families grow. Actually, that's a personal mission of mine. And we in Inova are here for you in this regard. So I know that every fertility journey is unique and each person's desires and needs may vary. So we offer a very inclusive fertility plan and approach. Not only do we have a state-of-the-art embryology lab, but we also really make sure that we're providing essential and personalized fertility care for all kinds of families that are coming to grow. And we have, for a very long time, recognized that there's a very diverse landscape that defines family throughout Canada. So most of the services that we offer are OHIP funded, but we also recognize that it's just not about the fertility care, it's about how we provide the care, how we recognize everybody that's involved in their family building. And we also have emotional support as well as wellness support for patients as they go through their critical family building plans. So we also have a page on the website that's dedicated to our families. And so you can visit us at inovafertility.com, and it's / now I have to read this, LGBTQ2IA. So it's / LGBTQIA. So you can go there and it'll define our offerings in detail. So you'll be able to access what it is that we have in as much as all of the options available to our wide variety of families. So all of that said, as a preamble, what we're going to have tonight is a bit of a webinar to talk about what the services are, and the top 10 questions will get answered. So without further ado, I'm going to begin with the first question, and this I will read as I go. So the first question is, what is reciprocal IVF? I've read that it's a good option for LGBTQ plus couples. So reciprocal IVF allows for primarily, I would say, my lesbian couples and also trans men with a partner that has a uterus to grow their family in a collaborative way. And so what this means is that the one partner in the couple, so partner A will say, partner A will be stimulated for in vitro fertilization. And by the way, in vitro fertilization just means that you're fertilizing eggs and sperm, or the two gametes that are needed to make an embryo, in a petri dish. And so you stimulate partner A to grow the eggs up. You take the eggs from partner A, and then they get combined with donor sperm. The embryos are grown up in the embryology lab, and then those embryos are transferred into the uterus of partner B. So both partners get to feel intimately involved in the family building process. It's not for all couples, but I would say that the highest uptake is for lesbian partners. And then I'm seeing more and more of my trans community come in, of course, those who have a partner that has a uterus, to do the same kind of a process. And so those are really the definitions of reciprocal IVF. And it's really growing in popularity. I think over the past few years, there's been more and more reality TV celebrating this as an option. And so my patients are coming with that specific regard. Of course, if you aren't interested in reciprocal IVF, we can do straight insemination as well. So next question, question number 2. How do I know I need a surrogate or an egg donor or both? So in as much as third-party assisted reproduction is concerned, it really just means that you require the services of a third party, either someone who possesses eggs or someone who possesses sperm if you don't, or someone who has a uterus if you don't have one. And so I have a variety of patients that come in for third-party assisted reproduction. Sometimes people just know that they would require these services because they were born without a uterus, or they had a medical process or a medical condition that prevents them from being able to carry a baby. So that would be someone who has brittle diabetes, or they are taking medications for a condition that won't allow them to carry a baby safely. Sometimes it's patients who have come to me after a really long and protracted fertility journey, and they know that they need to have a gestational surrogate, someone to carry the baby. And then sometimes patients don't feel that they are able, for whatever reason, to carry a pregnancy. And there are two types of surrogacy, to be clear. So the first type of surrogacy is what we call traditional surrogacy. It is the first type of surrogacy that we have. And that's where the person carrying the baby or the embryo that grows is also the person that provides the eggs for the baby to grow. That's traditional surrogacy. Now that we have access to in vitro fertilization much more readily, and we do this every day, it's also preferred by virtue of the fact that the person who would carry the baby doesn't make the eggs as well. So they're essentially like a stork, carrying, or an incubator, or a fancy condominium to carry the pregnancy. And there's no relationship genetically between the person who's carrying and the embryo that's growing. And for families that are building through third-party assisted reproduction, I think it gives them a little bit more comfort that there's no genetic relationship between the gestational surrogate and the embryos. So that's the difference between traditional surrogacy and gestational surrogacy. And are there sometimes patients that require a variety? I call it variations on a theme, like a symphony. Sometimes patients require an egg donor. Sometimes patients require an egg donor and a sperm donor. Sometimes patients require an egg donor, a sperm donor, and a gestational surrogate. But what we see mostly for our LGBTQ2S+ community is that we have gay men that require a gestational surrogate and an egg donor. And we see these couples from all over the world. And then also couples who have reached kind of the end of their fertility journey, or who have the need for donor eggs, because I've talked about surrogacy and reciprocal IVF. I didn't talk about egg donation. So there are couples or individuals whose eggs no longer work that require a third party's eggs in order to create the embryos to make the babies. So gestational surrogacy, traditional surrogacy, and egg donation. And there are variations on the theme of all of those things. Sometimes people require one, sometimes people require all three. Okay, question 3. Do I need a referral for my partner and I want to work with a surrogate or an egg donor? Do I need a referral for any of those services? So the answer is no, because much of this isn't necessarily covered by the insurance health program. Some of it is, but it isn't always. You can just go to the website and make an appointment with a third-party program team, and then they will begin the process of onboarding you. You'll have a consultation, etc. But it does not require you to pay for consultation. Okay, or you don't need a referral. Then it is, my partner is older in age and not sure if their eggs are okay to be used in the IVF process. What are our options? So it's interesting that that's a popular question. It's difficult to answer without being able to have the pieces of the consultation that we require in order to know how good the eggs are at functioning. So what I mean in this is, as a physician, when I see a patient, my job is that of a magical fertility data cruncher or computer. And so I have to put the necessary pieces of the puzzle in to figure out how good or how likely it is that someone's eggs or sperm or uterus will carry a pregnancy successfully. So even if you have a partner who is older, not everyone who is older has the same details or ability to get pregnant based on their data points. So for example, when I'm looking at someone's eggs to see how good they are at making babies, we look at some blood markers. One is a day 3 FSH. Another one is an AMH, or anti-Mullerian hormone. Another one is an ultrasound marker called an antral follicle count. And then we look sometimes at the ovarian volume overall. And then the other part is we look at the uterus or the womb to see if it's appropriate to carry. And even if you've had surgery beforehand, or if you've had other medical procedures on the uterus, it needs to be assessed at the time to establish whether or not it's going to be easy or difficult, or if you're a good candidate to carry a pregnancy. So you really do require a consultation for me to be able to obtain that data and for me to be able to extrapolate how likely it is that you are, if you are older, to get pregnant easily or to need the services of an egg donor. And all that said, ideally, a woman's or someone with ovaries ability to make good eggs really starts to diminish significantly at age 35. And that is something that I find myself repeating often, because when patients come requiring third-party assisted reproduction, it's not because you're infertile necessarily, but it's because you're in obligate needs of eggs or sperm or a uterus to carry a pregnancy. So often it's a shock if a couple comes or an individual comes that possesses ovaries and they come later to care after the age of 35, only to discover that they also have issues that would challenge them to get pregnant easily. So I encourage patients to come sooner rather than later, regardless of what kind of a relationship you're in, to have a fertility assessment. And this also counts for those who possess sperm as gametes. So those with testicles should have some kind of a fertility assessment at some point as soon as possible, so that if there is an issue, there is more of a runway to deal with it and I have more options available. Okay, so if your partner is older, yes, it's better to come to care sooner, but it doesn't necessarily mean that you'll be a bad candidate. The good news is that if you have eggs and your eggs are challenged because you're older, we, number one, would have the eggs of your partner if you're in a lesbian relationship. Number two, we have options of egg donation using third-party assisted reproduction. Okay. So do I need to see a counselor if I choose to use a donor? So talking to a fertility counselor during your fertility journey, if you're embarking upon third-party assisted reproduction, doesn't necessarily mean that you're going to be judged to see if you can be a parent or if you're appropriate to be a parent. That's not what the counseling is. And there's something in Canada called the Assisted Human Reproduction Act that stipulates and recommends that there be counseling when you are requiring the services of a third party to conceive in any way. And so that kind of counseling is implications counseling. So for example, it allows you and your partner to have discussions about how are you going to tell your child, or when are you going to tell your child about how they were created or how they came into the world? Are there books? Is there literature? Are there websites? Are there support groups? Are you on the same page? Are there things that you need to hash out? You will never be excluded by virtue of the social worker's consultation. It's just one of those steps that's added in to ensure that you've had a chance to really consider all of the options. I actually think that all fertility patients should have that kind of a consultation, because it's different when you require medicine to help you grow your family. But nevertheless, the Assisted Human Reproduction Act stipulates that when you are using the services of a third party, that you should be having a visit with a counselor. The good news is that at ANOVA, we have a roster of counselors that you can work with, so that you have an opportunity to find someone who is a good fit for you and for your family. And so when you come in for your consultation, as part of the initial onboarding, once you've decided how we're going to go about this, we have a list of counselors who can not just be there for implications counseling, but throughout the journey, you have someone to touch base with if it does get difficult emotionally, because it can get difficult emotionally. It doesn't work 100% of the time immediately. And therefore, having someone that you're familiar with, that you can bounce things off of, that you can vent your emotions with, is recommended and advisable. Okay, so there are so many options to have a baby. How do my partner and I know what method is best for us? Okay, so I alluded to this a little bit earlier, and I said that I'm a fertility computer cruncher data analyzer, but it really does require some workup. So part of the workup to figure out what the best option is are those things that I mentioned earlier. Blood testing, so that's the AMH and the day 3 FSH. There's also something called a sonohysterogram if you possess a uterus, to assess the anatomy to see if the womb is an appropriate place to grow, or if it requires a procedure like a renovation before occupancy. Okay. We also assess the gametes for those who possess testicles. So we have to look at the quantity and the quality. So the quality being the shapes of the sperms, and then the purposeful movement of sperm, which we call motility. And every individual with ovaries or testicles will have their own specific data. And therefore we have to look at that and then decide what the best option is for you. So sometimes if I have a young female or a young lesbian couple or anybody that possesses ovaries that is early on and wants to consider donor sperm only, that would be appropriate for just insemination. But then if there is any evidence of stress or strain on the ovaries or the quality of the eggs in any way, or if someone is presenting at an older age, I may recommend IVF right off the bat for someone who possesses ovaries. For my gay male couples, obviously we will be needing eggs and gestational surrogates. So it's a process of explaining what kind of a person would be ideal for egg donation. So for an egg donor, ideally, we like them to be less than 30. When patients are older or they present with an egg donor who's older, or a friend of the family or someone they know, then we have to assess their independent data variables and decide what the best therapy is. Would it be IVF, which is most likely? And then there's also gestational surrogacy. Not everyone who possesses a uterus is an appropriate candidate for carrying a baby. So it's my job as the physician, and it's the job of the physicians at Inova to do a proper fertility assessment and decide if those players who are coming to the table for your particular family building journey are appropriate and in your best interest. And so sometimes as part of the assessment, when I do a medical assessment for a gestational surrogate, or I'm doing a medical assessment for an egg donor that you would present with, I may actually say that they're not an appropriate individual and you need to go back to the drawing table and find a new egg donor or potentially a new gestational surrogate. And that sometimes, it's rarely happened actually, because there are a lot of checks and balances before even an agency would necessarily onboard an egg donor, or before even you would have the opportunity to bring them to the clinic. They may have been somewhere else where they know that their fertility potential is great. But in absence of that, it's my job to independently assess and then tell you this is a good person, we should go forward and move forward with egg donation or gestational surrogacy or not. Also, even semen parameters, when I look at sperm, I also am assessing those independent variables to say there's a good likelihood of pregnancy easily, or there are additional tests that we need to do on sperm. Even sperm can be compromised. I know sometimes that surprises individuals, but sperm comes in all shapes and sizes and all varieties. And there are many reasons why sperm can be compromised, and therefore things need to be done. You might need to see a urologist before you would proceed with your IVF cycle. So it's hard to know which option is appropriate for you. The most important thing is that you recognize, after I've said all of what I've said, that you need to book a consultation and you need to have an independent assessment for us to determine what the best route is for you to conceive, okay? So is surrogacy legal in Canada? That probably is the biggest misconception that I see, because I've seen patients from all over the world, and even our domestic patients here in Canada are under the erroneous, wrong impression that surrogacy and egg donation is illegal in Canada. So that is a giant myth, and I'm here to bust that myth. It is 100% legal. It is not legal to pay an egg donor or a gestational surrogate, but you can reimburse for reasonable expenses. And that is very explicitly delineated in what legislates all of that, the things that we do for assisted reproduction. So it's regulated by the regulations around sperm and ova in Canada. And Health Canada are the enforcers of this. And so when you're thinking about surrogacy and egg donation, it's thoroughly legal in Canada, and you have to go about it a certain way. So there are only certain clinics that are actually sanctioned to do this. Anova is a primary facility, and we are through Health Canada, sanctioned through Health Canada, and we're one of the first clinics in Canada to have gone through an inspection with them recently, since they changed the regulations as of 2020, May 2020. And we have been shown to be conform to these regulations, so we're fully equipped and prepared and sanctioned to manage these sometimes complex relationships. And I recognize also that Health Canada, in its regulation of this, has some processes that sometimes can be off-putting for patients, because they can be a lot of checks and balances that you need to go through. So we have to ask you, there are questionnaires you need to go through. You have to go through blood testing. You need to do a physical examination. All of these things can take a little bit of time, from your first appointment to your assessments, to your physical examinations, to your infectious screening, to questionnaires, but it has to be done just so, not only to protect you, the intended parents, but also to protect the third parties who are playing a role for you. So the egg donors and the gestational surrogates and the sperm donors. So Health Canada mandates this. And well, Health Canada doesn't mandate, Health Canada regulates it, but the Assisted Human Reproduction Act in Canada really very explicitly delineates what we can and can't do. And it's very important for you to be affiliated with a center that knows precisely how to manage it. And yes, Canada and the province that we are in Ontario is a great place and jurisdiction in which to build your family, because it recognizes the kaleidoscope, we'll call it, of family that exists and the diverse landscape that makes up family in Canada, okay? So when you're considering where to go for your third-party building journey, it's important that you are in a place like a country or province or municipality that understands how to do this safely and understands how to do this well and has experience doing this well, okay? How do I find a surrogate or an egg donor in Canada? Okay, so there are a couple of ways. There are lots of ways to find. I'm always surprised maybe at how people come to me with their own personal journey through their personal networks. Now that we are speaking more openly about family building and people are recognizing that there are options for all types of families and individuals, more and more people are coming to the table to offer help. So that means that patients can come with someone that they know from their personal networks as an egg donor. That can be complicated as well, but we have checks and balances that you have to go through. So even if you have a sister or a close family friend that has offered, for example, for a couple to be an egg donor, I have to make sure medically that this person is the right individual, that their eggs are the right eggs to grow a family with, and that you have a good chance of pregnancy using those eggs. So I have to do all of that fancy assessment of an individual that you would bring to the table. Again, ideally, someone who's going to act as an egg donor to give you the best chance of growing your family in the shortest amount of time, I would say, would be someone who is less than 30 years of age. And hopefully, potentially, they've completed their family building process, or they don't want to have children of their own. And then I assess them to look at their data variables and to see if their egg quality is good, their AMH, their day 3 FSH, all of those things are good. In addition to them being a good candidate medically, there are also, as stipulated in the Assisted Human Reproduction Act, things that checks and balances that have to happen. So that individual would have to have independent legal counsel to make sure that they understand what they're going into, the benefits and risks, and what the legalities of what they're doing are. You would have to have independent legal counsel as the individual or couple receiving the eggs. There's also the mandatory counseling visit. There are infectious screens that have to go through for both, for the individual providing eggs or sperm or gestational surrogacy. So there are all of these additional steps that we have to work through before that person is given the stamp of approval to become your egg donor or your gestational surrogate. That's through your personal networks. There is also the option of going through a professional network where you're provided the services of donors through agencies. So there are agencies that provide our patients at Inova with the services of egg donors that they have on roster, for example. And they would, then you would give them your prerequisites, let's say, your checklist of things that you're looking for, be it genetics or sometimes people are looking for an egg donor that's of the exact same ethnicity. Egg donors of ethnic minority groups are more difficult to find. So you might be working with a particular agency that provides you with egg donors of a particular ethnic background or has more variety. So egg donor agencies also understand the rules and regulations in Canada. There are a variety of them that we work with at Inova. Please know that we've also vetted all of the agencies that we work with and have vast experience with the variety of egg donor agencies that we work with, but also that we're constantly critically appraising. We're always looking to see if there are other agencies that are doing a great job, and we are willing to assess them to see if they're appropriate for us to work with as an organization or you as couples looking for egg donors to grow your families with. So there are egg donors that can come, egg donors and gestational surrogates that can come from your personal networks, and then egg donors and gestational surrogates that come from agencies. Just always remember that we have to adhere and be conformed to all of the checks and the balances that Health Canada requires, and that we must adhere to be conformed to the Assisted Human Reproduction Act. So that might be a little bit of why people think it's illegal, because it's not. I'll reiterate, it's not, but there are certain steps that you have to go through. And sometimes that would preclude someone from being an egg donor. So if you have an egg donor that has an infectious screen, for example, and Health Canada has stipulated that we can't include that person because of whatever infection they possess to be an egg donor, I don't have the authority to override that. We have to fall within the guidelines of the regulations. So again, that's why it's so important to be at a clinic that understands what you can and cannot do to be conformed with Health Canada and the Assisted Human Reproduction Act and those regulations, okay? So wherever you find your egg donors or gestational surrogates, it's still the responsibility of the physician and the clinics to assess them independently for appropriateness and for eligibility, essentially. Okay. And the final question I have is, do a lot of people come to Canada to have their families through surrogacy and egg donation? The simple answer to this is yes, but there are many reasons why. So there are still countries in which surrogacy and egg donation are governed by laws that are extremely limited. So while I said that Canada is a good jurisdiction in which to do this, they recognize the variety of families and individuals that are accessing recourse or who have recourse to these services. Other places in the world are not as progressive, and in fact don't recognize many of the individuals in the LGBTQ2S+ community for these services. So that's why Canada is one of the preferred places. There are also some countries that don't even recognize two fathers as parents, or individuals who aren't married to be parents. So it's hard for us to conceptualize as Canadians, but if you are not married, you are not eligible to access the services of a third-party assisted reproduction through a fertility clinic. In Canada, you can, and so that's why Canada is a popular place. Also, the Canadian laws recognize children born through surrogacy from the beginning of the planning of the making of the embryos. So that means that once the baby comes out of the gestational surrogate, the names on the birth certificates are of the intended parents at the beginning of the journey. and not the gestational surrogate. So that is a big difference from many other jurisdictions, and that gives a lot of the intended parents much comfort to recognize that they are recognized as parents at the beginning of their journeys of family building. The Ukraine has been historically a popular destination for individuals seeking the services of a gestational surrogate or an egg donor. Unfortunately, due to the unrest and the circumstances currently in Eastern Europe, it has been very difficult for patients to, or for intended parents to continue to access care in the Ukraine. And so Canada has gained popularity because they recognize that we are regulated, and the Assisted Human Reproduction Act and this Health Canada's regulation makes the checks and balances feel safe for intended parents. And so Canada has become a more popular destination because we do this well. We have great technology in places like Inova. We have great technology in the embryology lab, and we are regulated in a way that protects all parties that are involved. Okay. And then also, you know, I see a lot of US clients as well, because in the US, gestational surrogacy and egg donation is in a more commercial environment. So it is more permissive in as much as what egg donors or gestational surrogates can get paid for their services. And just frankly, it's less expensive in Canada, not to mention that the exchange on the dollar is less expensive. So the services are less expensive, and then the exchange on the dollar makes it attractive for Americans also seeking the services of third-party assisted reproduction. So, but the most important, I think, and what patients need to consider quite carefully is there are checks and balances and laws in place to protect all of the parties involved. The intended parents, the egg donors, and the gestational surrogates need to be protected in this. There are risks associated with this that sometimes we don't consider when we're looking at accessing the services of egg donors, gestational surrogates. And it's important for everyone to be protected. As a physician who is taking care of not just my intended parents, those families that want to grow their babies, but also the individuals who are providing the patients with with their own eggs, egg gametes, sperm gametes, and also a uterus to carry the pregnancy in. It's important for me from a medical perspective to feel like I am doing a good job by being a good doctor for everyone involved. And so when you are considering growing your family in a place, you want to be sure that everyone is protected, that your outcomes are optimized, and that you are going to somewhere that recognizes and sees you not for the first time or is learning how to do this, but has a vast amount of experience and recognizes the potential pitfalls and challenges, and will be there to support you through the journey from start to finish. And I hope that I have managed to impart to you through this evening, through the questions that got answered, the hot questions that you had, that Inova really prides itself. I pride myself as a physician, but all of the physicians and all of the collaborative staff at Inova, we pride ourselves on being able to bring all families, everyone being welcome, and recognizing that we must individualize care for all of our patients.